Hello everyone, myself Dr. Arpita Shrivastava, Associate Consultant Neurologist, KMC Hospital, Dr. B.R. Ambedkar Circle, Mangalore. Vitamin B is a very essential water-soluble vitamin in the human body. Not just brain, entire body is deeply dependent on vitamin B, adequate sources. There are various kinds of vitamin B. Vitamin B1 is important for eyes, B6, B12, B9, all are important for peripheral nerves. B12 is also important for memory, also for spinal cord functioning. The tracts of the spinal cord, all are heavily dependent on nutrition supplied by vitamin B. Vitamin B1, B6 and B12 are the most important vitamins which are helpful in neurological peripheral neuropathy management, but all other varieties of vitamin B are also important for neurological health or any damage caused by the deficiency. So all vitamins are essential for neurological repair. Depends on how severe the damage is, but ideally 5 to 6 months on a regular required dietary allowance doses should be adequate for treating neuropathy. B1, B6, B12 are usually adequately present in our diet. B1 and B6 are richly present in all green leafy vegetables, milks, fruits, etc. B12 in itself is not very rich in vegetable sources. Non-vegetarian source of food is a good source of vitamin B12. Peripheral neuropathy can be very disabling condition for any human being, be it because of diabetes, be it because of vitamin deficiency. So adequate treatment leads to improvement in the disease, and it also helps patient living a good quality of life. Vitamin B should be present in adequate amounts in the dietary sources of each and every patient, not just for neurological health, for entire body health, and it should be consumed in recommended dietary allowances.